We start by telling you that the Minister of Health, Professor Ali Pate, on Friday met with the leadership of the National Association of Nigerian Nurses and Midwives and representatives of the Ministry of Labour. The closed-door meeting was part of ongoing negotiations between the Nursing Association and the Ministries of Health and Labour. Nurses and midwives under the association had commenced a warning strike on Tuesday, following what the union described as the government's failure to respond meaningfully to its 15-day ultimatum issued on July 14, 2025. The strike stemmed from long-standing concerns about nurses' welfare and poor working conditions and the government's reluctance to address their concerns. The ongoing warning strike involving nurses and public health institutions across the country is expected to continue till August 5, 2025. Let's now cross over to Abuja quickly, where we understand that our correspondent, Aishat Salihu, is standing by for some more updates. Aishat, good afternoon to you. Now, the meeting is on as far as we know. What more can you tell us?
Thank you so much, Lekon. Right now, the meeting is over. They have just risen from the closed-door meeting, and the details of the meeting are still really sketchy at the moment. We have from authorities that the strike has not been called off. I just finished speaking with members of the union, and they did mention that the ministry presented some of what it's still ongoing anyway, but the process is still ongoing, but the ministry presented their own offer. So it is left for the Association of Nurses and Midwives to go back alongside their National Executive Council to know what works for them, if this works for them, and if it doesn't work for them. And they said they will come up with a public story, a press statement by Monday once that meeting has been carried out. But right now, the strike is still ongoing, according to the information I gathered from the executives of the association. But then there has been demonstration ongoing. Before now, they met, and the Minister of Health and also representatives from the Ministry of Labour, just so that they can find ways around calling off the strike. So part of the demands of the nurses are very, very mundane. Some of their demands are something that they have been clamoring for over the years. And from what I gathered, they are complaining of shortage of manpower, inadequate facilities and equipment to work with, which has led to improvisation over the years. And also the fact that there is shortage of staff. They say that Nigeria produces over 10,000 nurses every year, but then when you go across the facilities, you realize that there is still shortage of these personnel. So these are the issues they are asking for. Also, the scheme of service of nurses to be gazetted, and also the Directorate of Nursing at the nursing department in the ministry, to create more room for directors, just like it is for other professionals within the healthcare sector.
All right, Aishat, but we're hearing unconfirmed reports that probably this strike has been called off. Can you confirm?
From what I have gathered, the Director of Press at the Ministry of Health mentioned that deliberations are still ongoing. And also from the leadership of the union in the FCT here, they also mentioned that the strike cannot just be called off like that. They have to meet with their own union, the National Executive Council of the association, to look at what the ministry is proposing to see if it works for them. And then they can then come out with a press statement by Monday to be sure if the strike will be called off or not. But right now, from what I have gathered, the strike is yet to be called off.
Thank you so much, Aishat Salihu, for bringing us that update as regards the nationwide strike by nurses and midwives in Nigeria. I would definitely come back to you some other time to get more details as you get updated.